Rhinoplasty can be considered in two ways. One, whether you're having a functional problem, you're having a breathing problem, and you're trying to improve your breathing. Everybody wants to breathe well. So that would be one reason to seek rhinoplasty. Another reason, which is a common reason, is that you like who you are, you like how you look, but something about your nose doesn't fit very well. And some people will tell me, I got my dad's nose, I got my mom's nose, and I want to tweak it a little bit. So two reasons. One, for a functional reason, to be able to help you breathe better. And two, because your nose features, nasal features, are out of place and you want to rebalance it with the rest of your facial features. There are times that you've always had a nice nose and you are fine with it, but then as a result of trauma, you break your nose is crooked, you really didn't take care of it, now it's all crooked and you want to straighten it out. It will be one reason. Sometimes some people get skin cancer, so the nose is fixed, then it makes their nose look off, and then they can have it refined to make it look better. With a rhinoplasty consultation, you should think of it as a beginning of a process, not an event. You are seeking information. You have in your mind ideas of how you think your nose should look. Commonly, people will come to a consultation with pictures of other people. And then from my standpoint, it gives me an idea of what the person is looking for. But at the consultation, you really want to hear from the specialist, because as a team, you come together and plan what will be best fitting for the face. So as a rhinoplasty consultation, you are coming with your ideas, the thoughts of what you want your nose to look like. Your specialist is going to tell you about what they think is feasible and workable and will look really good. In addition, there should be an exam to look inside your nose, because you never want a nicer looking nose that doesn't work very well. One of the features that defines who a person is actually their nose. If you change the way a nose looks, you will change the way the person feels about themselves, how they fit in their family, and really their self-confidence. So rhinoplasty should be taken after thoughtful deliberation. The unique thing about rhinoplasty is that the result that you see right away is not the result you're going to see in a year or 5 years. So the rhinoplasty surgeon should be able to sculpt a nose, expecting it to change in the direction that we both want, the patient and the surgeon, looking at long-term results. How would I know my new nose will fit my face? One, don't depend on selfies, because selfies always distort the nose. But more importantly, usually we are looking at facial proportions. After a rhinoplasty, nobody should focus on the nose. The nose should blend in the face without anybody knowing that something has been done. The focus on conversation should be on the eyes. So we are usually looking at proportions. We look at the shape of your eye, where your forehead starts and ends. We look at the distance between your eyes, the shape of your nostrils. All those features are put into consideration when planning a nose. We fortunately have technology to help us. We can take three-dimensional photos in our office, put it in a computer, and simulate the surgery, so you can have a good idea of what changes will look and how it will fit on your face. A natural looking nose is one that doesn't look operated upon. So if your nose calls out rhinoplasty, it doesn't look natural. A natural nose doesn't look pinched. It blends in your face. It fits with your other facial features. So a nose that is too fine, too thin, too sharp is not natural looking. So when we are doing rhinoplasty, we look at your ethnicity, your background, traits that are congruent with your facial features, and then try to plan the surgery accordingly. One should not go for changes that look too harsh, because over time, they just don't look right. As you can imagine, rhinoplasty, there are different degrees of changes that are done. There are some rhinoplasties that we actually do under local. The patients are not asleep. We can do it in the office, and you walk out and your nose looks much better. And usually those rhinoplasty centers about changes in the tip, changes in the nostril. The recovery usually is days. When we have to do major changes, particularly when the nasal skin is thick, you should think of this as a process again and not an event. Early on, it looks good, then it swells a little bit, and then over a period of 3, 6, 9, 12 months, the refinement continues. So think about the early recovery when you can be back to your normal activities. That's usually within a week. But think about the long-term results. You have to budget yourself, and in your mind, say this is a process that will take about a year. Nobody should do a rhinoplasty and end up with a pinched nose that makes them sound different and they cannot breathe. So when we are seeing patients for rhinoplasty, we always look in the nose. We try to see where the breathing issues are present. And as we are reshaping the nose to make it look better, we are also thinking about function and trying to correct breathing issues. The answer is yes. Some people have had rhinoplasties, multiples of them, and usually they keep changing their mind as to what they want. This is what you want to avoid. But in general, if you've had a result that is not pleasant to you, you can seek what we call a revision rhinoplasty. And you should always take your time and make sure you pick the right person, because the returns become less and less the more surgeries you've had done. Rhinoplasty is one of the most common things that we at Johns Hopkins perform as facial plastic surgeons. We work on the nose all the time to try to make people breathe better. We also work on the nose all the time to make it look better. You would be expecting years of expertise from specialists who focus on the face and the nose only.